take a look at this scene because something special is happening here. It's the scrub room at a hospital in Prince George, British Columbia. All looks routine until you hear about the doctors scrubbing in.
Are you guys ready for us to start?
That's Dr. Nadine Caron, and she is Canada's first female Indigenous surgeon.
Can I have a flower, please?
She's in constant demand at the hospital by her patients, at home by her 10-year-old daughter, and at medical conferences across the country where she's trying to change the way we treat Indigenous people.
The patient is the expert. Everything down to their cultural history and their cultural background and where they reflect from.
Every day, she sees the impact that racism has on her patients and on her as their doctor. Caron is also a professor at UBC in Vancouver. She often drops by the Museum of Anthropology. It's where we met. One of the areas that you've been fairly outspoken on is the issue of racism within the healthcare system, which is a difficult discussion, and I'm sure at times a painful one for you, at times caught in the middle on this. Give me a sense of an example for you of how you've seen racism within the system when it comes to the patient care that's delivered for First Nations or Indigenous peoples.
An example, a patient walks into my office and she's a First Nations lady that's traveled the distance. And I walk in and I ask her what nation she's from, and she tells me, and I explain, oh, you know, I'm Anishinaabe, I'm from the other end of Canada, and she starts to cry. She just breaks down crying. She's, I don't know, in her early 80s, and she says, I never thought I would ever see and come to talk to an Indian doctor. 8 decades. She goes, you gotta meet my grandkids. You gotta talk to them, you gotta come to my community, you gotta tell them that this is possible. So there's that element of it where that you just see this relief, you know, sort of wash over her face.
And what's it doing to you?
It's amazing. It's an incredible honor. It's an incredible responsibility.
What is the racism in that story? Is it simply that this woman in her 80s had never been in a situation before where she was being dealt with by an Indigenous doctor?
Yeah, and that's how it started. And then we started talking, and then I started realizing that a lot of the things that was on her sort of chart that had been said to me by the referring physician, there was so much missing, things that she hadn't done. And so she'd come to me for one reason, and we started talking about, okay, besides all that, you know, have you had a mammogram? Because she didn't trust going into the medical system. But I had this opportunity to work with her to sort of say, okay, how can we take advantage of this safe space that we have right now to optimize the things that have sort of fallen off the wayside because of a level of distress. I still see it too much. I feel it too much, and I hear about it too much. Want to take that? And so you use it as a pen, like a pen, yeah.
Have you had the opposite example where a patient has come to you, and when that patient recognized that you were First Nations, they said, you know, I'm not comfortable here?
Yeah. You know what? I'm not that I'm aware of, not that I'm aware of. But having said that, I don't share my background with someone who's not Indigenous because I don't think they'll care. I don't think they'll find that as a positive thing. Is that why you don't? You
don't share because, well, at that point?
Yeah, I don't think that
wouldn't be a positive thing.
I don't think they'd find that a positive thing.
Is that a pretty sad admission?
I guess it is. When you wear your white coat or you're a physician, people don't say racist things right to your face. When you have initials after your name, they can't really say, those stupid Indians, those First Nations, their graduation rate, they can't even get out of high school. They can't say that kind of stuff because I'm protected by these sort of Western measures of success. but I hear it. And I hear it enough because I have this honor of meeting on a daily basis new patients that come through the door and share their stories with me.
What about your colleagues? What have you seen, not necessarily about you, but about the patients? As you're saying in Prince George, where most of your work is, a lot of the patients are Indigenous or First Nations.
Yeah.
A lot of the surgeons, obviously, are not.
Yeah. Yeah.
And so what do you see from them?
Yeah. There are a few examples that really hit home. I remember one in particular because it was a fundamental learning experience for me very, very early on in my training. And when you're training, you're in so many different hospitals all over the country. And I was sitting in this lounge, a surgery lounge, and a gentleman came in that was obviously a surgeon that had just finished a long case. He was sweaty, and I know the feeling. You can be pretty drained. And he sat down at our table and he said, "Whew, you know, if I never operate on another Indian, it'll be too soon." And it was hard because it was awkward. It hurt. I was angry, like this instantaneous, like gut reaction to it. And so I always say, my mom taught me, if you ever feel that way, just count to 10. Don't say anything. Don't do anything. And so at the end of it, I just sort of said, well, you know, if you don't want to operate on an Indian and get paid, then you certainly don't want to eat with an Indian for free. And I sort of packed up all my stuff, put it on my tray, and walked away. And I didn't know what else to do, but I needed to get out of there. And I also needed him to hear that it wasn't all right, and that it hurt, and that it was wrong. But it was odd because as I went across the lounge, slowly, one by one, the other surgeons at the table that I was with, they packed up their stuff and they moved away too. It was awkward. And eventually I looked over and he was sitting at this table by himself. And then next operation started. I had to go get ready, and the day went on. And then it wasn't until much later, about 4 years later, after that day, I was in a situation where I was seeing him quite frequently again, and he came up to me and he said, you know, do you have time to talk? And I said, sure. And I thought he was going to talk about a clinical case or a referral or something. And he said, I wanted to apologize. And I was like, apologize for what? And I was thinking, could he possibly be talking about this? Because I thought to him it was just another day. And he said, do you remember it? And I said, I remember it. I remember it. And he said, well, I'm sorry. And I said, well, what are you sorry for? Are you sorry for hurting my feelings? Are you sorry, like, what are you sorry for? And he said, well, that's just it, Nadine. He said, I know that if I would have said sorry that day, you never would have accepted it, because it's bigger than that. And I've been thinking about it, and throughout the years, when I see a patient who's obviously Aboriginal now, I catch myself. I think about that day. I think about that experience. I think about what I said, and I realize just how wrong it was, and my assumptions and the biases and the stereotypes and the racist way I thought. To hear his apology, so honest and transparent and so genuine, and what I've said is, I think that's the apology that Aboriginal people in Canada are waiting for.
You know, there are probably thousands of Canadians, if not hundreds of thousands of Canadians, who would like to fulfill what you just said. And they probably don't know how they can do that. You know, people argue, and you know, I've witnessed it for longer and seen it, that exact kind of feeling that doctor had in the initial conversation. But I think we're living through a time now, I think, you know, people tell me that we are, where Canadians have realized the wrong was done. They've listened to Truth and Reconciliation. They've listened to Murray Sinclair.
Yeah.
They're not sure what it is they're supposed to do.
Yeah. You know what, it's come up in conversations that I've had, and I think it's having the courage to dive into the history of what our country is made of, and looking at it differently, and recognizing that that's who you are as Canadian, and be proud of everything that's great about Canada, and fix what's not.
We're part of the Mangandotum
Yeah, you can say it really well.
Wolf Clan. The wolf brings the spirit of the people together and teaches the importance of family and community. Be kind to your family. Always try to be thankful for them.
I've witnessed firsthand how residential schools continue to impact the generations that follow. My daughter is 10. I asked her permission to tell this story.
Thanks, Mom.
We were driving one day, and she was 4, and it was in the springtime, and so it was just a couple months away from when she was starting kindergarten. And I'd actually even taken her to the school where she was going to be going to show her, this is the school, this is the playground, and she was pretty pumped about that. And I'm driving her to her daycare one day, and I look in my rearview mirror, and she's sitting in the booster seat, and she's crying. Like, tears are just streaming down her face. So I don't know what's going on, so I pull over, and I'm like, Alia, like, what's going on? And we had just driven by this development. There's only one big, huge house on this development, and it was just dirt, surrounded by dirt. And there's no siding on the house, and one of the windows was broken, so it was all boarded up. And she said, "Is that where I'm going to school?" I said, "No, you're not going to school there. I showed you the school. You're going to the school with the playground." And she goes, "No, is that where I'm going?" And I said, why would you think that? And she said, "When you drop me off at school, are you going to be allowed to pick me up? Are you going to be allowed to see me?" And then I realized, just sort of thinking about, she's heard about my mom's experience. She's overheard me talking to my mom. She's overheard the stories on the news. She's Canadian. It was an eye-opener to me that I couldn't shelter her from this history, and nor should I.